More than 2 years into the pandemic, millions of COVID survivors say they still don't feel right. The government estimates as many as 7 to 23 million people are affected by long COVID, and a Census Bureau survey suggests that among people who have been infected, 1 in 5 are still experiencing lingering symptoms. Experts are warning this mass disabling event is affecting the workforce. Senior policy reporter Ann Flaherty joining me now for more on this. And you have been following these cases of long COVID since the beginning. What stands out to you most from your reporting?
Well, there were really two things. One is that long COVID is very real. We talked to doctors that say, I used to cover help stroke victims, treat brain injuries. Now they're all about long COVID, and they have these long 4 to 6 month wait lists. The other thing that we found was that it's knocking people out of the workforce, and a lot of young people, even people who were vaccinated, if their immunity had waned with time. We interviewed one young woman, 26-year-old Victoria Waldo. She used to be a ski instructor. On the weekend, she worked 70 to 80 hours as a finance developer with a solar developer. And, you know, she really loved her job. And about a month after getting COVID, she was completely knocked out. She had a 4-month blackout period where she doesn't actually even remember Christmas. At one point, she didn't recognize her wedding planner. So that has a big impact on the economy when somebody that young can't go back to work.
Yeah, and you underline there how this is really affecting the economy in general. Statistically, this is one story, but is this happening across the nation?
So the government estimates that it could be anywhere from 7 million to 23 million people. There was a survey that the Census Bureau did that looked at, okay, how many people out of all of us who've gotten COVID, which seems to be most of us, 1 in 5 are still experiencing lingering symptoms. So, you know, the question is, how much is this knocking people out of the workforce? You know, when you go to disability insurers, they don't have good data. But I talked to one economist who says he counts the toll at $3.7 trillion. That's including all the medical care and the lost earnings.
That is a big number. What kinds of symptoms are patients experiencing, and how are they coping?
So, you know, there are something like 200 symptoms that can be associated with long COVID. You know, the number one thing that we heard from the people we talked to is cognitive dysfunction. They call it brain fog. So to be clear, all of us feel like we are tired, you know, maybe we have bad days, maybe we don't want to go to work. This isn't it. For these people, you know, like in Victoria's case, she couldn't get off the couch. She couldn't remember things. She doesn't remember opening gifts on Christmas. So it's really a different level where people can't seem to function, and they have to go through cognitive therapy where they're actually relearning how to think.
And very serious indeed. Thank you for bringing us this story. Ann Flaherty with us there.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.